morning. You know, I find myself a pretty unlikely warrior trying to improve care for people living with dementia. You know, back in 2018, I found myself on the better side of 2 decades into trying to help build Starbucks into a caffeine giant. I joined in my early 20s, and I would go on to get the honor of leading the U.S. business there. It was a great experience and a company and a culture. And also back in 2018, I found myself with 2 parents living in rural Arkansas, both in their late 70s, who had independently 2 very near misses with our long-term care system that almost killed them, that I found shocking and terrifying and actually pretty sad. And I had this epiphany that maybe I could use my 30 years of experience to try to improve a corner of our healthcare system that I thought was urgently in need of some much more innovative thinking. And it was shortly after that I made the very unlikely leap from selling coffee to the helm of a very large assisted living company. Now, of course, COVID would come 12 months later, and I would find myself with a front row seat, and I do mean a front row seat, caring for the most frail and complex seniors anywhere in the world at what was arguably the most difficult time in modern history for this group of seniors. Now, I had a lot of observations, shocking observations about the state of senior care while I was working in assisted living. But the one that puts me here in front of you today is this. I was shocked by the remarkable frequency with which we send our seniors with dementia to our emergency rooms and hospitals. It's hard to believe, but every day across our country, tens of thousands of seniors end up in our emergency rooms simply because their caregivers, their families, cannot manage their symptoms that dementia so reliably presents. So reliably presents. And I'll show you a little data that will back this up. This yellow line, we're not gonna avoid the emergency room as a senior. There's no doubt about that. And this yellow line is a very average senior without dementia and the number of times that they visit our emergency rooms on a number of months and years. And this red line is a senior with dementia. I show this to you to validate the fact that our seniors are in our ER, our seniors with dementia are in our ERs way too much. And they go much earlier than conventional wisdom might let us to believe. That blue line is the point of diagnosis of this disease. So we see our seniors coming in the months leading up to diagnosis and the months after, way too often. But what I can tell you is the emergency room is the last place you want to be if you've got dementia. Generally, there is very little they can do for you, and you almost always get admitted to the hospital. Now, I want to tell you a quick story about a woman named Beth. Beth is 83 years old. She got diagnosed with dementia a couple of years ago, and she's kind of mid-stage with the disease. On a Tuesday night not long ago, Beth got aggressive with her husband. Now, in the world of dementia, we would call this agitation or even severe agitation. Her husband didn't know this was going to happen because no one had ever told him, despite the fact that these symptoms are incredibly common at this stage of the disease. He also did not know that there were some tried and true things he could have done in that moment to calm Beth down, to reduce her agitation. Now, it was 9 o'clock on a Tuesday, so he couldn't reach Beth's doctor, so he called the nurses at the local hospital, who didn't know Beth, who didn't know her conditions, who didn't know her medical record, and they suggested he take her to the emergency room. So he did. After 8 hours in the emergency room, 6 days strapped to a gurney in the hospital, 2 weeks trying to develop enough physical strength for her to walk back into her house, and having spent $32,000, Beth finally made it back home. More frail, more confused, and much more medicated than when she left. Our EDs are not made for patients with dementia, yet they have become the go-to for so many families when there's nobody else available. And Beth, just like many seniors across the country, will repeat this cycle many times over during their journey with dementia. Now, we tried to solve this problem when I was working in the assisted living business. Believe me, we saw it in Technicolor every single day. And what we realized in doing so was and this is going to sound dramatic, but it's 100% true. There's hardly anybody in America who knows anything about dementia. I'm going to say that one more time. There's hardly anyone in America who knows anything about dementia. And that's because we've never paid for it. We've never cared enough about these seniors, our families with dementia, to actually give them the care they need. And I can tell you that this part of our care system is deeply broken, and we got to fix it. Now, a couple things about dementia. Dementia is the highest probability, lowest visibility disease that exists today. And it is rapidly becoming a global health epidemic. There are about 8 million people in our country today who live with this disease. There are a few million more who've got it, who don't know it, but soon will. And I'm going to give you an amazing statistic. At the age of 85, which the majority of this room will see, you've got a 1 in 3 chance of having just Alzheimer's. That doesn't include all the other dementias out there. A 1 in 3 chance. And our post-World War II generation, our baby boomers, those 70 million people who make up the biggest cohort of population we've ever known in the world, guess what? They're just getting ready to hit that magic number of 85 in the next couple of years. And we are going to see the biggest epic wave of folks with this disease in the history of time. And I got to tell you, we have a giant challenge ahead of us. A giant challenge, and we are woefully, woefully unprepared for it. Now, if I haven't scared you enough, I'm just going to pile on here for a second, if that's okay. Dementia is also the most expensive end-of-life disease there is, more expensive than cancer and COPD and diabetes. It's because you live so long with this disease. In America, we're going to spend about $350 billion taking care of our dementia patients this year. Just for context, that's about 1/2 of our entire defense budget in the United States. And that number is expected to skyrocket to over $1 trillion over the next few years as those baby boomers arrive and need our help. And I can tell you that we have an urgent need to build a national infrastructure, a national care system that gets this specialized care into the hands of people who need it and their caregivers and allows them to stay at home. Because we have no choice. And yet we are moving very, very slowly. And I am here today to ring the alarm bell. Now, fortunately, there is a lot we can do. And I want to give you 4 big moves that I think we can make over the coming months and years to really transform care for this group of seniors, this special group of seniors. And I want to start with the one that I think is probably the most important and difficult root cause challenge of this disease. And that is we've got to break stigma that's so endemic in this unique disease. You know, back during COVID, we were able to destigmatize and transform adolescent mental health in a very short 4 years. A remarkable achievement, and I think really a noble one. And yet, in senior mental health, and particularly dementia, it is still the untalked about family secret. We have made 0 progress, goose egg. And at a time when mental health is at the center of everything we do in medicine, why are we still whispering about dementia? Why? Now, I'll admit that, if you're an 80-year-old man and back in my hometown in rural Arkansas, the last thing you're going to do is raise your hand and tell people you're having memory problems. Because that is a social death sentence, there's no doubt about it. Yet, if we can get people diagnosed and into care, there is so much we can do. We've got to normalize this disease like we've done with cancer and other chronic diseases and make it okay to ask for help and get this issue out onto the table for patients and caregivers and families and communities. The second big thing we have to do is we've got to rapidly expand access to specialized care. We've got to get high touch, really specialized, low-cost care into the hands of the people who need it quickly. I can tell you that my company that's working on this project has been, and along with a number of other companies, are leveraging some really, really pioneering evidence-based research done at both UCLA and UCSS over the last few years, working on alternative dementia models. And They had a very simple idea that they could, particularly at UCSF, put together an interdisciplinary team of a few specialized clinicians who were experts in dementia. And that team was made up of a geriatric nurse practitioner, a licensed clinical social worker, and a care navigator, working together to wrap around a patient and a caregiver and to provide a range of services from clinical to psychosocial to care navigation and education. Delivering care 24 hours a day, 7 days a week, anywhere and anytime you needed it. And guess what? It had amazing results, both of these programs. It kept people out of long-term care much longer than averaged, kept seniors out of our emergency rooms and hospitals. It raised caregiver confidence and lowered caregiver stress, two quantitative triggers we know lead to emergency room visits. And by the way, it did all of this at much less cost than traditional approaches. Pretty amazing. In the case of UCSF, it actually taught us also that this care, specialized dementia care, could be delivered entirely virtually, allowing us, with the same efficacy, by the way, of in-person care, allowing us to get this care to you whether you live in the biggest city or the smallest rural town in America. Now, remember Beth? Had Beth had access to care like this, had her husband and her daughter had access, she could have avoided all of the trauma that I detailed to you earlier. The 8 hours in the ER, the 6 days in the hospital, the 2 weeks in the nursing home, and by the way, $32,000 that she spent. She could have stayed at home where she wanted to be and does better, right? We know that. So, and I can tell you that this is possible because we are doing it right now very successfully here in Seattle and across the country. But I also can tell you that we're not ready to pay for it. We're not ready to fund it appropriately. We don't yet care enough about this group of people to do that. So the third thing we have to do is we have to fund it. In this shadow of this epic wave of folks who are on their way to us for care, they're already here, frankly, we've got to get the right investment behind it. Now, I'll tell you that there's some green shoots to report here. Last summer, our Centers for Medicare and Medicaid Services introduced a brand new innovation program to provide care, like I described, to seniors with a diagnosis on traditional Medicare. And my company, along with others, are enrolling seniors successfully in that program, and we are starting to get some momentum. But Medicare is only half the country. If we really want to expand access, we have to get to the other half of the country that's on a Medicare Advantage plan. And I think there's a big opportunity to do some really pioneering work in value-based care here and develop a program with insurers to expand that care to lots of other seniors beyond Medicare. For those of you who are not experts in Medicare, which I hope is almost everybody, I can tell you that value-based care has been around for a while, but is getting traction. With lots of other diseases. There are lots of successful models in cancer and diabetes that have shown value-based care can really work. And dementia fits perfectly into this playbook. And just to describe value-based care, for a provider like me, we don't get paid unless we do a great job. We deliver a better outcome, and we do it at lower cost. And again, dementia fits well into this playbook. Smarter, better for the patient and the caregiver, and way less expensive. We should do this. The last thing and the fourth thing that we have to do, and maybe this is the most important one, is we have got to identify and train and develop and inspire a clinical and social workforce ready to go take this on. It's hard to believe, despite our overwhelming need in America for geriatric clinicians, almost 40% of geriatric fellowships go completely unfilled each year. That is not true in any other discipline. We are just in no way attracting the volumes of people that we need into this space, doctors, nurses, care navigators. Not even close. And I got to tell you that we got to spend the next few months and next few years making caring for seniors with dementia sexy. Yeah, I said that. Sexy and noble and special. You know, as I tell my 15-year-old daughter all the time, you better like old people because this is what you are going to do. No doubt about it. Now, I'd also say that, what an honor it is to care for people at this stage of their lives. Noble work to care for those who cared for us. 4 big moves we can make that we have to make to transform this care. I'll just close for this. At Ripple, the little company that I founded to try to take on this challenge, all of us know this disease personally, for better or worse. We know what it's like to be a caregiver, a family member, and even a patient. And I can tell you that we also know that this care is incredibly, it's not working. It doesn't work for the patient or anyone involved. And that makes us angry because we know it can be done so much better. My grandmother passed away a few years ago after a long battle with Alzheimer's. Believe me, my family knows the emergency room very, very well. And my dad, a former Marine living in rural Arkansas, who's a man of relatively few words, sent me a text recently that said, this care you're trying to create, had it been around when your grandmother was alive, things might have been really different. I mean, you talk about rocket fuel for those of us who are trying to make this better. We won't help my grandmother, but we might help yours. This disease is going to touch every single one of us. I guarantee that, probably sooner than you think. And I cannot think of a better example of resonance at work than how we come together collectively as a community to take on this giant challenge. My ask of you is to get smart. You realize what is happening here and how it's going to impact you and your family, and you tell others. Because we have got to get real quickly about what it's going to take on this challenge. Because what is true is this. This may very well be the healthcare challenge of our generation. I know that sounds dramatic, but I think it is true. The patient and this disease are complex. There is no doubt about it. But I'll tell you, the care solve is straightforward. We know how to do this. We've just got to build and commit to taking care of these folks. And lastly, we've got to admit that it's worth it. We've got to admit that these folks are worth giving the investment and care they deserve. To live a dignified life at home and not warehoused away in some facility somewhere. Let's give them what they deserve. They are our family. If we do all of these things, I can promise you the benefits are going to be enormous. And it starts with getting the national conversation about dementia front and center in our country, making it okay to ask for help, even expected. And then quickly and urgently building a national infrastructure, a care system, like we have for cancer and other diseases, that can help keep these patients at home and safe and dignified. That's what we have to do. And if we don't, there will be a lot of people that will have choices otherwise. We know how to do this so much better. Thank you. Let's get to work.